So why doesn't my doctor know this? Hi, I'm Dr. Thad Deal, and I'm very often asked this very same question, and I never really had a great answer for them until I came across this article from the National Hypothyroidism Association, which really does an excellent job explaining why your doctor may not know some of the things that we're talking about. And I'm not going to read you the entire article, but I'm going to go through and highlight some important points here that help explain. And it says historically that they failed to adopt a new concept and treatments based on new knowledge or newfound understanding demonstrated in the medical literature. And understand, these quotes are coming out or directly out of medical journals. It goes on to say that they have a long history of guidelines and recommendations that are not supported by the medical literature, and they fail to adjust or abandon recommendations when new understanding and knowledge contradicts their recommendations. So a doctor who follows outdated society treatment guidelines that rely on simple laboratory tests and ignores the clinical aspects of a patient is not practicing evidence-based medicine. In other words, you just can't look at the numbers, the lab values. You need to look at the patient in front of you, how they're presenting, they're telling you that you feel. Because if you continue to suffer, if you continue to have symptoms, then your lab test may not all be normal as you're being told. A large percentage of endocrinologists and physicians who feel medicine can be related to simply reading normal or abnormal in a laboratory column. To further complicate that issue is the fact that laboratory values are non-standardized, meaning that they can vary from state to state and lab to lab. And when your doctor only has the opportunity to go through and look at those highs and lows, they may fail to miss things if they aren't highlighted due to the differing lab values that these labs are using. There's a gap between what we know about disease and what we do to prevent and treat that, as our knowledge base grows, will eventually become wider. And this is actually a quote from William Shankle, a professor at University of California School of Medicine, and he says that most doctors are practicing 10 to 20 years behind the available medical literature. Now, this article goes on to explain that the insurance-driven model, the traditional model of healthcare, perpetuates this practice by penalizing any doctor who wishes to practice on the latest scientific evidence. Because if all your colleagues are practicing 10 to 20 years behind, that's the standard of care. That's the usual and customary. So if you want to be on the cutting edge of evidence-based science, you're going to be considered investigational. And that's why so many people, one of the reasons why so many people fail to be helped within this traditional model. If you've been doing the same thing for 5, 10, 15 years and it's not working, you need to look outside that traditional medical box that you've been put into, because we've taken that acute care model and applied it to chronic conditions, and we're failing miserably. So if you're interested in a doctor who looks outside the box, who is practicing based on 2012 evidence-based science, I invite you to call our office to set up an initial consultation and discovery visit to find out whether our unique comprehensive approach may be the answer to your health problem, may be the answer you're looking for. Our office phone number is 814-238-0232.